So the question I've had during my rotation that influenced my desire to make an adaptive equipment handout is, how can I be beneficial as an occupational therapist for someone who's only appropriate for an evaluation and discharge? So one day, me and my clinical instructor were talking about a specific group of patients, and she really gave me something to think about as I was about to enter one of my patients' rooms. She said, if this is your only opportunity to work with this patient, what is the most important thing that you can give them or do to benefit them during this one session? So I thought about education. Well, what kind of education? It all depends on the patient. So I began to think about our elderly population specifically. This includes our patients that are adamant about returning home and those who really wouldn't benefit from continued therapy upon discharge. So when I began to think about this population, I put myself in their shoes. At 80 plus years old, who would really want to be taken out of the comfort of their own home due to inevitable physical changes that we all experience as we grow older? So I began to think about what would benefit this group of patients and make them safer in their home environment. So adaptive equipment came to mind. There are so many pieces of equipment that would make such a big difference in one's daily routine, but many people are unaware of these items unless they've inherited them from a spouse or family member who's experienced issues in the past, or if they themselves have experienced previous surgeries or issues, or etc. So I began to reflect on how many patients were just so excited to use the sock aid for the very first time. And I could see their faces light up as they were doing something that they haven't been able to do in years. It was so rewarding to experience this. And then I thought, well, there's so many other things that would be beneficial to these patients. Then I began to reflect on some of our sessions where we tried to make recommendations. So you pull out your phone, you go on Amazon, you attempt to show your patient the equipment, and you get one of these numbers where the patient is trying to zoom in on your screen to see what you're talking about and what you're recommending to get a better view, or the Wi-Fi is messing up in the room, or they're trying to pull it up on their own electronic devices, or they forget what it's called by the time you walk out of the room. And ultimately, this wastes a lot of time during your evaluation process that can be used to provide something else that can be beneficial to them during the session. So another issue here is that you have to remove your gloves in the patient's rooms just to pull out your phone in the first place. Then you have the patient who will reach to zoom in on your phone to see it better, and at the end of the day, you just have germs spreading everywhere. So the handout that I created for my facility will help reduce these issues. And I've listed the most common pieces of equipment that we recommend in acute care. I know there's an endless list of things, but I wanted to try to incorporate a list of at least a few items from each discipline for everybody's use, because as therapists, we all have one collective goal, and that's to keep our patients safe.